All right. So the research seminar, it involved many different topics. One was on epidemiology. That's hitting our nation. That's going to bankrupt our nation soon. I'm sure in the presidential debates on Wednesday you're going to hear a lot about our $16 trillion debt, which is definitely a concern and a drag on the economy. But really it's just a mere shadow compared to what's happening in the healthcare system, where now the new shocking statistic is that 1 out of 2 kids 13 or younger are pre-diabetic. It's not 1 out of 3, it's 1 out of 2. Another very shocking statistic is the kids that are not overweight, so in other words not obese, these are very normal healthy looking kids, 38% of them are pre-diabetic. So that's just an absolutely shocking statistic. 95% of these kids are undiagnosed. So we have this cloud coming down our horizon that's just going to envelop a healthcare system and totally drown it, because with these diabetics, obviously we're going to have so many different expenses, different diseases, that really is a concern. So some of the experts were gathered on it, and it was kind of fun to see some of the top doctors in the nation give their opinion on it. Anywhere from Dr. Mark Hyman to Dr. Oz to there's all these people that everybody knows, and they're all on the same page. And I'm still kind of getting used to that kind of feelings. Like I'm supposed to be an outlier and somebody really weird, and here I am kind of mainstream. But in a way, it feels good too, because the information is out there, is getting out there. I'm going to be jumping around because I made just a couple of notes that I thought you might be interested in. Here's a really interesting quote by one of the speakers, is that 10 companies control 70% of the food supply worldwide. Just 10 companies. It is so that they're manipulating our food. They have teamed their research teams together to figure out how do we increase sales, how do we increase people's addictions to our food. The ingredients in our foods are just there to manipulate our brains to want more and more and more of it. For example, we just got a new law passed that MSG, which is a neurotoxin, it is basically illegal in a lot of Western Europe. It creates a pathway of addiction that is very similar to cocaine in 92% of the people that have MSG. MSG is an evil ingredient. You know what it is now hidden as? Natural flavor. That's MSG. I did not know that. So I should have known that. I did not know that. And that's why I go to these seminars, to pick up these little tidbits also. So natural flavor, folks, it can be really evil, and it can make you want and crave some of that stuff. It also creates something called angry fat. There's 2 different types of fats, and there's some research now that shows angry fat is a different consistency than normal fat. It's more jiggly. It's a little bit more ugly, and it's very ugly what it does to us, not just aesthetically, but also health-wise. Angry fat spews out, like little volcanoes, inflammatory molecules night and day. This is why some people have such a hard time losing weight. They have angry fat that's on fire, and it just slows down metabolism, it slows down the thyroid, it slows down adrenals, it creates brain fog, it creates depression, which then creates overeating again, and it becomes this whole vicious cycle. Angry fat is a total 21st century malady caused by manufactured foods. Totally. So, a fairly new phenomenon. Dr. Jeffrey Bland, who's my mentor, mentioned also that all these syndromes that are now coming out, and he threw up a slide and it was just filled with small print, all syndromes that have just been invented the last 10 years. He says these syndromes are basically precursors to disease. And I thought that was an interesting point. He also went into how genetically modified foods, which is so common in our country, have now definitively proven, in fact he was at a conference last week, to change gut flora permanently. And we're going to talk about gut flora and what it does communication-wise to the rest of our body. And I think you'll be quite surprised by what gut flora all does. But genetically modified foods now also change to such a way that the pesticides for example, corn. Corn can be genetically modified to resist some herbicides like Roundup. So you can spray Roundup in a cornfield so the corn doesn't die, but the weeds do. Okay, so this genetic modification goes into our body, and now it starts altering the gut flora that we have. And guess what they start doing? They start producing Roundup. Yes, a lot of us are producing Roundup in our bodies. And this is just a tiny little example, because one of the next speakers, and it's not my notes, but it's just random, he says he was shown how male testosterone levels have been declining for the last 2 generations precipitously, that today's males now 73% less fertile than just last generation, and the average testosterone level in a 40-year-old is equivalent to what it was in a 70-year-old just 30 years ago. You hear what I'm saying? Testosterone levels are just declining like there's no tomorrow. And hormones are very sensitive to the environment. These are the same hormones that now we are also finding that wild animals are becoming fat. Isn't that interesting? Their diet really hasn't changed much, has it? I mean, they're still running around and eating the grass and this and that. However, the grass has changed. The leaves have changed. The foliage has changed due to our environment, due to some of the genetically modified foods that they go in the fields and eat. And that is changing their insulin receptors. And when your insulin receptors go bad, you become fat. Also, some of the antibiotics, okay, follow me now on this one, that gets fed to the animals, and it's unbelievable. I think it was 297 million pounds a year that gets fed to our cattle. It's 8 times as much antibiotics gets used by our cattle as humans here in the United States. Those antibiotics passes through the gut into the feces, which then gets converted to fertilizer, gets put on the fields, and up to 5 years later is still putting antibiotic residues into our plants. And that's why 37% of our crop is now laced with antibiotics. So that's why I had this startling statistic that I couldn't figure out just a few weeks ago. That was a study that came out on organic food that said 34% of them had traces of antibiotics in it. Now I know why. Because antibiotics just don't go away. So even in an organic field, there's some antibiotics left if it was not organic to start with 5 years ago. Isn't that interesting? And antibiotics, folks, makes us fat. How do we fatten up cattle? I've worked on a ranch. I know exactly the tricks of the trade to make these cattle fat. 1, you don't move them around too much. Number 2, you do not give them grass. You only give them grains. And number 3, you give them antibiotics. That's how we got our cattle fat. They become fat because what happens is you change the gut flora, you change digestion, which makes them fat. Yeah, they go to market in half the time compared to a grass-fed animal. Yeah. So, anyhow, told you to be all over the place. Are you okay with it? Okay. So, interesting statement by Dr. Bland. With food, you change your quality of your inputs in your body. And really, his theme on food was, forget about the proteins, carbs, and fats. Sure, they're important, they're interesting, and okay, we need enough protein, carbs, and fats. We get that. But really, when you eat food, you're really signaling to the body what it should do. If you're eating a Mars bar, you are lighting up all those little genes in your body that are evil. If great-grandma had MS, you're lighting up that gene. Does that make sense? If dad died of a heart attack, and you're eating that food that is genetically modified, that is maybe a gluten product, especially glutens, that gene lights up. You also have the capability to taking foods and lighting up only the good genes, which then shuts down all those bad genes. And that's how you can change the way your facial features are in a Down syndrome baby. We just had a patient come in that had autism, last week. He's an older patient, And I asked for pictures before the report of findings from when he was ages 2, 4, 6, 8, 10, just all the way through. Mom did a great job. Put it all on a sheet. And I was watching this very cute kid, totally quote-unquote normal looking. His face just transformed until now, when he's an older adult, very misshapen in our view. And why is that? It's because all the wrong genes got played up all the time, creating nutritional deficiencies. And when you get nutritional deficiencies, the brain starts misbehaving, but even the body starts misbehaving, and you get the deformation. Does that make sense? And he had the genetic code to go there. I'm hoping to try to replete his depleted body with super nutrients so that he can actually reverse that process, at least to some degree. You'd like to catch him earlier, but that's how this can happen. Yeah? Did we get all that? Okay. Weight loss, very interesting statistic, and it got me really thinking about what we do here at DBC also. It's something I've heard before, but it really got pounded at home. And that is patients who were in a community doing weight loss had twice the success as those that just were doing it on their own or had a nurse practitioner telling them what to do. There's something about community that really makes weight loss much more successful. And that's something that all of you know intuitively, but it's nice to see the statistics also. And the doctor says, well, how many people do you have refrigerator rights to? And I'm going, refrigerator rights? He says, yeah. He said, refrigerator rights. How many people do you know that you can just go into their house and open their fridge? He says, well, that's a really good signal, or a good mark for how well socially connected you are. But yeah, that's kind of interesting. That's kind of interesting. I prefer not doing it, by the way, because to me it's a tale of horror that's in most of those fridges, but just kidding. All right. That wasn't very funny, was it? No. Your grocery store is your pharmacy. Remember that. Your grocery store is your pharmacy. Big talk on cancer. Got really, really in depth there. But basically, file this one away. It's summed up in a book called 5 to Thrive. Excellent book, excellent speaker, very, just amazing amount of research. She went through all the incredible biochemical pathways on how cancer's formed. I can give it to you in one word: inflammation. Whether it's fueled by too many carbohydrates raising insulin levels, or exposure to pesticides or smoking, okay, which all lights up your inflammatory pathways. And if you can kill inflammation, you can do an incredible job with the cancer rate. And she was talking about survival rates. And this was a colon cancer study. Colon cancer, intense study. They got one group of patients to eat 1.5 cups of raw broccoli once a month versus the ones that didn't. Survivability rate increased by 47%. Just about 1.5 cups of broccoli a month. It's just unbelievable. That to me says there's so many people that are so depleted in nutrients, it's just unbelievable that even just a touch will make a difference with them. Doesn't it? And there were some other studies that had them juicing some cabbage and all that. This was with breast cancer. And it was doing some raw vegetables, and it was the equivalent of 1 cup that they had to drink versus, and the other group was just a sham drink. And the survivability rate with advanced breast cancer was 67% longer life after diagnosis. Just vegetables, folks. What it was doing was suppressing some of the inflammatory signals. It is one of the strongest things out there. Can you imagine a drug, if it was discovered, that said, well, we increase survivability by 37%? It'd be over the headlines. Raw broccoli. Yeah? Not very glamorous. Yeah. One of the things leading up to cancer is childhood stress, a very new study. It shortens something called telomeres. Telomeres is very related, it's a genetic thing, to how long we live. And childhood stress shortens telomeres tremendously. The good news is telomeres can be lengthened again. First time I ever heard that. I always thought and was taught that telomeres, once it's done, it's gone. Okay, you shorten your life. There's no way you can reverse that. It's reversible. And to me, that was pretty phenomenal. Some of the top foods for those that are on chemo, by the way, was melatonin. It's not a food, it's a supplement. 20 grams a day, and mushrooms. So, and big studies were presented on that. Brain seminar. I'm going to run over time, so I'm going to really shorten this one up. But at 50% of us are expected to get Alzheimer's at this point. There's different types of Alzheimer's, some which are worsened by fish oil. So you got to be careful with some of the patients on that. Others are helped by it. And this is a very brilliant researcher from Cornell Medical School, and also has a big neurology wing in the Bronx, and owns a big research clinic. And he is finding that simply the best thing he can do for his Alzheimer's patients that are still in the beginning phase is clean up the gut. It's going to be our topic tonight. That's where all the medical research is now going to. Yeah. A big professional athlete research was done also. I'm going to keep that one for another seminar, because that one gets pretty in depth, and that one will be really good for the January seminar when we get into exercise more. Has anyone ever heard of Johnny Gray, Mars and Venus? That guy. He was a speaker there, and my goodness, what a character. Very fascinating, the differences in the male and female brain, how they react to stress. We're talking not acute stress, we're talking chronic stress. We have something called an amygdala right back here. Only guys can turn that one off. It's not physically possible for a woman to turn that off. In fact, under stress, it goes up twofold. Any woman will tell you that. In fact, after supper, the guy's sitting there, just looking. His wife will go, well, what are you thinking about? Nothing. How can you be doing that? You got this and this and this and this to do? I don't know. So, thus it starts. Another thing that happens is that when a guy goes into relaxation mode, blood flow to the brain stops. Literally. The frontal cortex stops. It all just goes to the basic survival ones. With women, with the relaxation, blood flow to the brain increases 8-fold. 8-fold. And the only way that a woman can get that thing to go down is to do something that is nurturing. Studies have shown that. And Dr. Johnny Gray said, you know, I'm afraid I'm not going to be politically correct, but I got to report what the research says here. They said if a woman then starts doing something that is nurturing, oxytocin gets released, oxytocin will relax the adrenals, and that's how fulfillment kicks in. Hand a baby to a guy, he says his stress levels will go up. Oxytocin levels has the opposite effect on the male brain, has the opposite effect. It totally stresses them out. Isn't that interesting? You know what relaxes the guy's brain? Testosterone. This is why a guy has his cave. And he can go out there and mess around with whatever he's messing around with, whether he's messing around with a dirt bike or whatever he's doing, he's getting his testosterone levels up, which is relaxing. Kind of unique how we're different. And I'd like to, at some point we'll do a seminar on that, because I think we could save a few marriages here. If you understand how these hormones work and different, I said, oh, he's doing his thing that way, and then the man can relate to the woman better, and the woman can obviously relate to the man better, as long as you understand that different language and what it means, and give each other a little space and make it work. So it was kind of entertaining. I can go in much more detail, but we are not going there. So, research regarding the gut. Fasten your seatbelts. Yeah, any questions before I go on? Yes?
I did. I have a question. You talk about childhood stress.
Yes.
But Can you give an example of how that can be helpful? What to do?
What to do? Eliminate the stress.
But in the child, how do you do that?
Yeah, we're actually going to cover that in a seminar.
Oh, okay.
Yeah. So we'll go there. Did I get it?
Yep.
Yeah. Did you have your hand up?
Oh.
No? Okay. Perfect. Okay. This is interesting. Article was gone through here. By the way, we have 100 trillion bacteria in our gut. It's called the microbiome. The microbiome has more genetic material in it than we have in our own genetics. We have 23,000 genes, as you may know. The microbiome, it's about 20 times that. We have 10 times as many bacteria in our gut as we have cells in our body. It controls us. It is part of us. It is not an enemy. It's there, and it affects how we digest, how we break down our molecules, our vitamin levels, our hormone levels. It's almost like we're the skeleton that is controlled by these extraterrestrial creatures. It never got respect that it should, except by a few outliers. And we're going to go into it. Chronic diseases that are now hitting the rich world are mostly microbiome related. We have this antithesis to bacteria because in the 19th century and 20th century, the bacteria was finally figured out. We saw it under microscopes, and we figured out a few of them actually caused death. Back then, infectious disease was the #1 cause of death. The antibiotic was figured out in the 1940s, and voila, that was going to be the end of it, and bacteria was the enemy, and no one really paid attention to what was going on in here. So bacteria, evil, load on the antibiotics, and lo and behold, here we are today. Literally 94% of all autoimmune diseases are gut flora related. That is a big number. Most depression conditions, and most brain conditions really, are gut related. We are now figuring out that things that we had no idea, like type 1 diabetes, just 4 weeks ago, it was discovered that a rogue bacteria in the gut breaks down a fat in a certain way. From that you get a side compound called acetic acid, which then goes into your bloodstream, activates the immune system, which then attacks your pancreas, type 1 diabetes. It's a rogue imbalance in the gut. They have finally figured it out. They don't know what to do about it yet, but it's there. And that's why we don't have slides on it yet, because really all this is just really new new things that are just coming to light. The complex carbohydrates are broken down into small fatty acid molecules such as formic acid, acetic acid, butyric acid, and these are the compounds that liberate energy from our foods. But if you have too much of one and not the other, that's obesity. So you have to have a perfect balance of good bugs versus bad bugs. And this was first seen in 2006. And the research was actually done on identical twins, one obese, one not obese. And they finally figured out that even though they're eating the same, they thought at first it was thyroid, it was adrenal, something. Nope. All it was a difference in bacteria in the gut. One of the identical twins is obese and the other is not. And this is in identical circumstances. The one got some infection at some point in life, maybe got an antibiotic, maybe was on some medication that the other one wasn't. Remember, identical genetic material here, identical food, identical most things. And it's absolutely amazing how just the gut difference made the one obese and the other one not. Heart disease, diabetes, multiple sclerosis, all that totally linked to gut disorders at this point. Yes. MS really is a disease that is a bug that transfers from the gut into the bloodstream, attaches itself to the myelin sheath, and strips away the myelin sheath. There's MS. We know it's related to gluten, and we now know that gluten feeds that bug. Isn't that interesting? So I can go on, but honestly my time is running out, so I'm going to jump into the slides and let's have fun with those. Okay. Stern warning given in 67 predicting the antibiotic resistance epidemic due to plasmid formation. Bacterial learns how to resist antibiotics. This was first found in 67. It's become a huge problem now. And because of that, we have now increased our amount used unbelievably, which of course has phenomenal problems. These antibiotics, as I mentioned earlier, are found in vegetables, all vegetables that you buy, even organic vegetables. And some of us that are really sensitive to these antibiotics are going to be profoundly affected by this. This was, here's the whole study that I was sort of talking about. The accumulated concentrations of antibiotic named sulfamethazine, also commonly used in livestock, is found basically in all vegetables. And I mentioned how cattle is used to, antibiotics is used to fatten cattle. It's amazing how in just 9 months this thing will be fully grown. If I could parade it in front of you, it is this long and this wide. And I know I've worked on hog farms. So it's absolutely amazing how these cute little pigs just go to market within a year. Yeah. Isn't there a saying like that? Little pig going to market? Yeah. So, how do antibiotics increase weight? Continuous low dose administration of an antibiotic can increase the rate and efficiency of weight gain in healthy livestock. So gut flora has changed. I just gave you some of the new information that just came out just 2 weeks ago. We now know how it works. The American Journal of Clinical Nutrition found significant differences between the gut flora of normal weight women compared to overweight women. And here's the study, American Journal of Clinical Nutrition 2008. By the way, all slides come from peer-reviewed medical journals. This is all pure medical news. It's just not being applied in medicine yet, and it's really a shame. Whole span of modern medicine is under threat because bugs are becoming resistant to antibiotics, rendering the drugs useless. The bacterium of C. diff, which Dr. Stacy is going to talk about, is linked to hospital records to 30,000 deaths a year, and I think that number has been revised upwards again, hasn't it? It has. So you're going to talk about that. So it's about twice the federal estimates and rivaling the 32,000 killed in traffic accidents. We've been treating C. diff here for at least 12 years. Dr. Stacy's going to outline how we do that. And I really think that we were the very first in West Michigan to actually treat C. diff because most doctors really hadn't heard about this until about 4 years ago. So take it away.
Most didn't see this article in the USA Today. This actually took up the whole front page and then 2 of the pages thereafter. So basically what they were talking about, they did a bunch of pictures of all patients that were killed from C. diff through hospital infections. Things that they don't talk about through these articles is how do you decide what C. diff is? Oh, mine's working. You're good. Sorry. Thank you, though. I'm like, why is he hanging out of my coat? I'm trying to hang me down here. So basically, Clostridium difficile, or C. diff, it's gram-positive. What that means is it's also anaerobic. So it's very hard to test for. Basically, the symptoms, what they look for is chronic diarrhea, usually lasting more than 3 diarrhea bouts throughout over 1 day. What they tend to notice, which is not always the truth anymore, is most people have had recent antibiotic exposure or they've been in the hospital, have a lot of abdominal pain, and a fever usually hits at the same time. The stool is very foul smelling. Downside of this, as you'll see through in the news, things that can be affected to create C. diff. Proton pump inhibitors. Who is on acid reflux meds? Anybody's on an acid reflux med, what they're finding is the majority of people who are on acid reflux meds shouldn't be on them because it can create C. diff. So even though, say you haven't had antibiotic usage, you haven't been in the hospital, and you come up with watery diarrhea that lasts for more than a couple days, you should be tested for C. diff because this is a possibility that it is showing up. The far more that could be done to stop the deadly bacterial C. diff that was in the USA Today that we talked about just earlier, what they're saying is basically the same amount of people die from C. diff infections as we do in traffic accidents every year. Now that's also something that really isn't reported a lot, so these are really stunning to the rest of us who know that intestinal bacteria is very, very important. We have just now started to see over the last 5 years doctors stopping to prescribe antibiotics for every person that walks in with a fever or an ear infection or any of those things, because they're finding that this is one of the things that are leading to these problems. The other thing that they find is, on top of this, there's over 347,000 patients who are affected by C. diff every year in hospitals. They don't know anybody else that has not been tested for these. What they're looking at is with the 30,000 that they see that have died from C. diff, those are the only ones that's actually written on the death certificate. The death certificate says somebody died from a kidney infection. C. diff could also be predisposing or alongside of that, so that's not written on the death certificate, so the death toll could be much higher than what they're actually reporting on that. So basically the C. diff is on rise in kids. This is a little bit scary. As we look at the kid thought, when you're dealing with this, a lot of the children that they were doing in these studies, they studied about all of the hospitalizations over the years of 2001 to 2009, and what they found is over 12,000 kids ended up having C. diff infections. 75% of those were never hospitalized and did not catch it in the hospital. So it's actually being transferred around through our communities through each child. So that is a little bit scary because we only thought that this was something that you could catch in the hospital from being on an antibiotic or whatnot. And those kids are not having those type of symptoms. One of the things that we'll talk about as an option for treatment is fecal transplantation. It actually helps, and usually you want to use a family member to do a fecal transplant, and you can cut the C. diff down almost immediately, within 24 hours, would you say?
Yeah, and I say 95 to 99% resolvement within a week.
And it stays that way, instead of constantly having to have somebody on a probiotic. Now I did come across some research as well that, as I was doing the other research, they said that, you know, Saccharomyces boulardii and probiotics can help prevent for those who are on antibiotics, C. difficile. But they also said that that was a very small study and needs to be a larger study to find out if it truly works. Well, we've been seeing that every day. In the office, that's actually one of our boulardii probiotics that we use. It has Saccharomyces boulardii in there. That is why we tend to use it, is for yeast and questionable whether or not we have a C. diff after antibiotics. So if anybody ever comes in and says they've been on an antibiotic, we will always follow up with probiotic unless there's some other factor that we think we need to do a different probiotic. Detection mode. There's a couple different ways to detect C. diff. Being an anaerobic bacteria, as soon as it hits the oxygen, it changes. So what they have found is they do this glutamate dehydrogenase test, which detects the antigen that's in the stool. So that can also tell if you have high amounts of the toxin and the non-toxin producing forms. You should always follow this up. It's the first test that they will do. They will always follow up with a toxigenic stool culture. The problem with the toxigenic stool culture is they have found that it takes 2 to 3 days for the results to come back. By that point, the patient can be dehydrated and very, very sick in the hospital. So they usually go off the first test, start treatment. Typically, the treatment is vancomycin and metronidazole, depending on where they feel the patient will respond best. Many times, those still deplete some of the good bacteria within the digestive tract. So different treatments and preventions that you can do. Obviously, we talked about the fecal transplant. Here's an interesting one that I found through the research as well. Washing your hands with soap, not the rubbing alcohol-based gels. How many people have been in the hospitals lately? What do they have outside every single door? An alcohol-based rubbing gel. And that's what we're trying to do to prevent C. diff. We're not using the hand washing stations like we should be. And then probiotics, because I'm going by what we have found for our most common prevention. So what causes this? Really what they believe for the longest time is overuse of antibiotics, breaking down the gut, which will break down the intestinal bacterial integrity, or the intestinal integrity, which then allows the bacteria to overpopulate. When you take out all the good bacteria, the bad only have an option to repopulate. Now there is about 3 to 10% of people, they're not really sure on that number, that also have C. diff as a natural occurring within their digestive tract. Most people do not usually have C. diff within the digestive tract, and you pick it up through contamination by touching somebody else. Contamination can last up to 14 days outside of the body, so if you have somebody who is infected, always wear gloves. Don't want to touch anything that they're touching. They say bleach is probably the best thing to clean with because it will kill C. diff. Washing your hands is obviously another really big one. But overall, when you're looking at this, after a stay of only 2 days in the hospital, 10% of patients will develop an infection with C. diff. This is kind of scary. Makes me never want to go. But if you have to be there, these are things that you want to use to prevent and things that we want to look for long term. Most people don't think of diarrhea as being a problematic thing because a lot of people will have diarrhea for a day or so and it's watery. But things to think about, especially if you're on a proton pump inhibitor. That's the one thing they are seeing as problems, because when you stop breaking down your proteins, you stop the hydrochloric acid, which is supposed to basically denature most of the outdoor chemicals that come in from our body, and we're not doing that. We also become nutrient deficient, which helps build up the bacteria in the gut, but then we end up creating an abnormal environment that allows C. diff to heal or to grow. So I'm going to turn it back over to Dr. Boer so he can finish up talking about your probiotics. Are you broken?
This C. diff is a huge topic. Thanks, Dr. Stacy. And I still remember our first case that we diagnosed here. It's about 13 years ago, I think, and was on my way to a conference in Montreal, and was listening to a radio, some health show on the radio, and it was they were mentioning how in Quebec, in some of the nursing homes, the elderly were dying of this mysterious new infection, and they had finally isolated it, and it was Clostridium difficile. And I just happened to have a patient who was using us as a last resort, as many patients do. Severe bloating, severe diarrhea, and really losing the battle. Had tried everything and had come to us, and I had run stool analysis, could not figure out also what it was, and I was really keeping him going with lots of probiotics and just good nutrients and loading him up, but really I felt like we were losing the battle on this guy. Wasn't that old, about 70. And so I couldn't wait to get back home and have a lab analyzed for C. diff. Had to really run around to try to figure out which lab would actually run the test. Finally did, and sure enough, that's what it was. So not much information was available yet at that point. We just loaded this guy up with garlic, and when in doubt, use garlic. Also used more powerful probiotics than I had before. As well as something called glutagenics, which is really L-glutamine. It's an amino acid that heals up a gut that's damaged. And it took about 6 weeks, but he totally eliminated the infection and is still alive today. So that was our very first case of C. diff, and now it's just truly become an epidemic. The latest statistic, we think more than 50,000 infections a year, or 50,000 people that die from it. So it's truly become a problem. So modern medicine must change according to the World Health Organization. The same organization, by the way, last week reclassified us. This is a startling statistic. We are now ranked by the World Health Organization as 42nd in the world as far as health goes. 42nd in the world is abysmal. It is so bad that we are right in the middle now of third world countries as far as our disease incidence goes. It is absolutely unbelievable. My home country ranked second. And why is that? What's the difference? I have feet in both areas so we can see what's going on different-wise. And lifestyle really is a huge difference. How medicine is administered is also huge. They're a lot less pharmaceutical-based over there. It really is considered more last resort than first resort. But lifestyle is absolutely huge, folks. And what's also interesting in those statistics is that we spend 34% more than the next country, which happened to rank, I believe, 22nd in the world, and that's Canada. So we're just way outspending almost anybody else, and look at the results that we're getting. So something has to be changed, and part of that is our gut health. And the gut health is really the end result of the environment around us. Not only the food we eat, but the pesticides we use, the sickness that we are spreading throughout our environment. It's really starting to affect us, and the wildlife too. This is where the three-legged frogs are coming from, and all those early other warning signs that are out in nature. Yeah. So, antibiotics for sinus infection, ineffective. This is JAMA 2012, but really it's repeating, the Journal of American Medical Association is repeating a warning from 2008 when they first recommended that doctors stop using antibiotics for sinus infections, and is still considered one of the top reasons to use antibiotics. It does not work. For sinus infections, an average of 3 antibiotics are used, and really the patient got well in spite of the antibiotics at that point, not because of. So it is just so wrong, because most antibiotic infections are not bacterial, they're actually viral or fungal. And we are creating health problems by putting patients on sinus or on antibiotics. Sinus infections are often gut related. This is a very strong case to make. Just like lung infections are often gut related, because the mucus lining in the sinuses are very similar to the mucus lining of the gut. And when the gut is inflamed and not well, the sinus membrane is not well either, and that's where these infections come from. So when somebody's chronically infected with sinus problems, their gut is mush, basically. That's really what's happening here. So live bacteria, yum! Okay, the good bugs helps maintain balance in our immune system. It is 70% of our immune system. It is our first line of defense. We always think of blood as being our first line of defense. It is not. It is our gut. And when the gut is imbalanced, our immune system is imbalanced. And that's something called Th1, that's a white blood cell, versus Th2. I don't really want to get into that too much, except to say that our primary way of treating allergies, whether they're food allergies or whether they are food sensitivities or environmental sensitivities such as hay fever, really what I'm doing is I'm treating Th1 versus Th2 cell imbalance. And the way to start with that is get your gut healthy again, get the flora balanced so that your immune response to the environment as well as food normalizes. So really the preferred medical way to do this is to block your histamines. Well, guess what? The horse is already out of the gate. All you're trying to do at this point is damage control by giving weird stuff that does weird things to the body. Okay, so we can disrupt our gut flora by antibiotics, antacid acid blockers, and proton pump inhibitors. Now, what is a proton pump inhibitor? Dr. Stacy mentioned that as being one of the causes of C. diff. A proton pump inhibitor would be Prilosec. That's the most common one. One of the top drugs out there. Prevacid is another one, right? And they're now over the counter, yippee. Did you know that our own FDA has approved proton pump inhibitors, so other things that fight heartburn, approved it for only 6 weeks of use? A lot of my patients that come in here, I had a fairly classic patient come in. This one was very classic. Executive, new patient, comes in on blood pressure meds, statins, and a proton pump inhibitor. It's just unreal how many of my patients are just on those 3. And really, this guy is sick within the gut. It's spewing inflammation into his body, pumps up cholesterol, pumps up blood pressure, and yes, he's got the classic gut. He's now got insulin resistance too, pre-diabetic. Yeah, it is so classic and unfortunately so predictable. But he had been on a proton pump inhibitor for 5 years. I'll bet you that's almost 50% of his problem, because you're stopping all acids, and now all kinds of unwanted bacteria pass unchecked into the gut and seed themselves there and make themselves nice and comfortable, most of them being fungal. I'll hit the questions later. And so these fungi then create, that's basically yeast overgrowth. They start yeasting away, fermenting away our foods, which creates toxicity from within, and that is called endotoxicity, folks. Endotoxicity means that whenever you eat, you are now creating toxins. So you might be having that great meal of beans and a little bit of corn and all the good stuff, but if your body is breaking it down in a weird way and putrefying it, you are creating toxicity from even the good foods. How depressing is that? In fact, it can be so bad that a cop can pull you over, you did not have one whiff of alcohol, you do the blood test and you are positive. In fact, you can be thrown into jail for being drunk because you had so much yeast inside your gut that you are creating alcohol, and you will be a positive on one of those on those traffic checks. I've seen it in the literature more than a few times. Isn't that ironic? Try to convince the cop of that one. Doc, it's the yeast in my gut. I could just see you trying to do that, right? It would take an expert witness to get you off the hook. Immunosuppression, maldigestion, absorption, and absence of fiber in the diet, those are all contributing factors. So this fermentation, I covered that already. The main function is getting rid of the food and make it into energy. So salvage energy, producing vitamins, and controls, fights against cancer, balances the immune system, gets and protects against the bad guys. The synthesis of vitamins is really amazing how you can spot that on a tongue. So any patient exam that we do, we always do a careful check of the tongue, because one, what the tongue looks like is what the gut looks like, and number two, nutritional deficiencies often show up on the tongue as well. So if a patient has scalped edges, got the white exudate, got a crack down the center of the tongue, very classic symptoms of a B vitamin malabsorption, mineral malabsorption. Then you quick go check the nails to say, well, has your hair been thinning lately? And you go into questions like that. Okay, now we got mineral malabsorption too. Do your knees ache when the weather changes? Yep, okay, now we got other issues. And it all goes to how we're absorbing our vitamins and minerals in our gut. So we protect by synthesis of antibiotics. Did you see that? This is our own pharmacy, folks. Our gut makes antibiotics. It's really cool how it works. And one of my sons was actually doing some research work with the antibiotic effect of some of the weird creatures in the gut, and how destructive it can be. It's absolutely amazing once those are unleashed how they can outperform our regular antibiotics. Notice that deconjugation of bile acids is on there, and what on earth is that? That is breakdown of bile. Did you know that most of your estrogen is secreted through bile, through your gallbladder? This is why women going through menopause have so many gallbladder issues. 50% of all gallbladders that are removed are in perimenopausal and menopausal women, just in a 5-year time frame. And that's because bile is one of our carriers to get rid of estrogen. We got to get rid of the estrogen, folks. Bacteria. How do we get rid of hot flashes? Well, we've got some pretty cool stuff, and I'm not going to go into that. But one of the very low-tech ways to do it is just to give the patient fiber. We increase bacterial action, estrogen goes away, hot flashes decrease. Isn't that cool? It's just very simple how some of these complex problems can be solved. Dysbiosis, one of our favorite words here at DBC. And when we palpate the gut, we first go to the stomach, and we're palpating the stomach, and that tells me a level of stress, too much acid, patients drinking too much coffee, ulcerations, right? Then we go down and do palpatory findings and do duodenum, so that now we're going down through here. And if it's really sore there, you think, okay, we still got a lot of stress going, and probably the patient is really sensitive to dairy products, gets very sore there. Then we go through the duodenum and ileum, and if that is sore, okay, now we got a major digestive problem. It's sore there too, it's spastic, it's got weird sounds going on. We're probably talking with multiple food sensitivities. Then we go into the large intestine, and once that's involved, we got a gluten-sensitive patient that has other kinds of damage, and we're starting to run the risk of other things like colon cancer, and this becomes pretty major because now the entire tube is inflamed, and that's why a good palpatory exam of the gut is so important, and it doesn't get done. And it is so basic because this is a big part of our health, and it seems like the art of the exam, the art of palpation, is just lost in doctors today because they just do not train it anymore in medical school. They just don't. And these types of things do not show up on a scan. It does not show up in blood work. We don't have it except just to get in there to ask symptoms, maybe do a stool analysis, a sophisticated one, and do palpatory findings. So, dysbiosis is abnormal bacteria overgrowth, where we have a shift in the bacteria, and that creates such an imbalance that it starts irritating the gut wall. And when the gut wall gets irritated, it lets through unwanted materials into the bloodstream. That's basically what we're saying with this gobbly-goo. And you get all kinds, in advanced stage, you get all kinds of dysbiotic diseases, such as celiac, Crohn's, diarrhea, IBS, ulcerative colitis, constipation, gas, those types of things. Those are all signs of just an imbalance in the gut flora. And then it leaves from there, goes systemic, and hits you wherever you're weak. So everybody has weak spots. There's an old football injury. Yeah, there's a kidney issue due to maybe some toxin that you were exposed to. You might have eczema. There might be acne. There might be hormonal issues caused by a liver that's not functioning well, and so thus the gallbladder's not working well. Guess where the toxin's going to go? Your weak spot. Yeah, it's going to go right to your weak spot. And if it's brain stuff, it's going to be brain stuff. And if it's foot stuff, it's going to be foot stuff. We have gotten rid of chronic knee issues. Sure, we work with it mechanically, but generally, if a patient comes in with knee issues, we do a gut check first, because that's where most of our inflammation comes from. And if there's something off a little bit over here, it's just going to exemplify that. The only time that we do not do that is like my last patient came in with a severe soccer injury. Well, I'm not going to check his gut. I'm checking for the injury. That's the exception to the rule. But for the most part, if something is a chronic deal, it is gut first, the chronic deal next. It sometimes drives our patients crazy. Well, doc, no, it's hurting here. Yes, I know. Give me time. I'm just checking you and not just the knee. And it's important to do that. So, brain fog. One of my favorite terms, one of Dr. Stacy's and Dr. Stelmach's favorite terms. Brain fog is basically not thinking clearly. And I am telling you, 90% of the people that are on the road today have brain fog. No. But I do feel that some of the bad driving we see out there is due to brain fog, endotoxicity, as well as over-medication. I really do. People are just not on it, and with the signal changing and watching where they're going, they're kind of drifting around like they are in a fog. And that's really the state of health. Yep. So there's a lot of systemic disease associated with dysbiosis and leaky gut. And that's acne, arthritis, autism, breast cancer, autoimmune disease. Yes, autism. So small bowel bacterial overgrowth. Now we're talking small intestine. It's a little bit different. It's more of a carbohydrate fiber intolerance, so more bloating and really fatigue. And more irritable bowel syndrome. The healthcare profession says we can't figure it out. We call it IBS, irritable bowel syndrome. That's really a small intestine disorder of gut dysbiosis. So yeast is very often to blame, but other fungi can be there as well. And how do you reverse something like this? Because this is what we've all been waiting for. What do we do with all this? Because it's a mess and it's very difficult to reverse. Well, you give probiotics and prebiotics. Probiotics is basically a supplement that has the bacteria in it, and prebiotic is the stuff that makes it grow. So it's a little bit like grass seed and the fertilizer. Yeah, that's really what we have to do. But that doesn't always work though, because sometimes you have to do the killer first to get rid of the weeds first. So in some cases we use killers, and I'll discuss those in a sec. I'm going to skip that one just for now. Properties of a suitable probiotic for human consumption. Okay, why did I just jump to that all of a sudden? Well, one of my pet peeves with probiotics that people are spending their hard-earned money on is they don't work. They just don't work for the most part. I took 7 of the most well-known probiotics, and this is quite a while ago, and I sent them to an independent lab and had them tested for live activity, And for content, and what kind of bug is it? Of the 7, 5 came back, no activity, none, 0. And these were big company names. 2 came back with live activity. One of those 2 had experienced genetic drift, which means they had replicated over and over and over and over again to finally it was some weird bug. That's what we call genetic drift. And only 1 had good live activity that was replicable inside the gut, could survive stomach acids, actually can help repopulate the gut wall. And that was something called the NCFM strain, stands for North Carolina something. But the NCFM strain to this day is the only one that researchers will use in gut research. There's a lot of weird probiotics out there, some of them earth-based, some of them actually fungi-based. Folks, they do not work. They do not, and you're wasting your time and money on them. So you really got to get the bugs that are of human origin and that are proven to be safe, because some of those other ones that are not of human origin can actually cause disease and has been known to do so. And the industry is starting to be slammed for causing death with some of these weird probiotics that are out there. Because if somebody has a very severe immune system that's compromised, or has that leaky gut syndrome where it can just go into your bloodstream, if it's a weird bacteria, you can cause problems. So we're pretty fussy with what we recommend. It has to be genetically stable and able to survive the intestinal transit, and also survive in the presence of competing organisms. Kind of important, don't you think? It has to be a tough guy that can resist the attacks of the bad guys. And it must be capable of not just passing through. Because I read something disturbing, that one of most probiotics that are out there, they just pass through. So I was really kind of bummed about that. So again, got to do the research, figured out which ones actually adhere and stay. And this is why fecal transplant from a relative works so much better than any probiotic I can ever give you, by the way. And that is because there's something very, very unique about probiotics that we are just now starting to figure out, is their genes somehow communicate with our genes. And that has been developed generation to generation to generation. Because as we pass through the birth canal, mom inoculates the baby with her bacteria. They replicate and are with you for life. And that was grandma's bacteria, and great-grandma's, and great-great-grandma, and you can go all the way down the line. And it has all been sorted out through the hundreds of years. So there's something really special about passing through the birth canal, getting inoculated with that bacteria, and thus a fecal transplant somehow can knock out these bad bugs like there's no tomorrow. Probiotics are just a mere shadow. We're just trying to figure out how to replicate that, but we're not quite there. So the story is to be continued. Did you get that, by the way? It's pretty cool and almost kind of weird. So you have to have clinical research also to demonstrate clinical benefit. This is what I'm looking for in a probiotic. So probiotics blocked invasion of human intestinal cells by the enteroinvasive bacteria. In other words, if you are infected by strep, came into a room today, said, Doc, I'm really sick, I don't want to shake your hand. I said, well, that's fine, but I wash my hands anyway. They said, no, I don't want to do that. I said, okay, but that's fine. But honestly, I am not one iota scared of getting her bug. If it's strep, it doesn't matter to me. If it's whooping cough, it really doesn't matter to me at all. Because I am trusting all this good gut bacteria. It is so crowded with good bacteria, it has no room to really infiltrate and settle in and take hold. That's how an immune system is supposed to operate. Because you can, the person next to me on a flight over here was constantly apologizing to me because she was sneezing and sniffling and going through all kinds of cleans. Don't worry about it, I'm not worried about it. And but very often I hear someone come in and say, well, I caught a cold from my next door neighbor in an airplane or a restaurant. And that might be true, but really it's your immune system that wasn't able to ward it off. And it's almost all, 70%, is your good bugs. So this is why in the fall and winter we often start supplementing our patients not only with vitamin D and a little extra C, but good bugs. Probiotics can improve the symptoms of irritable bowel syndrome, lactose malabsorption. And you know, that little statement that I just picked out of there is actually huge, because irritable bowel syndrome, we have thrown so much research into that. We have thrown so much of our healthcare dollars into it because it's such a common malady. From prednisone to acid blockers to this and that, nothing, and I mean nothing, has proven beneficial for irritable bowel syndrome except probiotics. I think it kind of bugs them. No pun intended there. So the importance of the strain, NCFM right at the bottom. Acidophilus and lactobacillus is the most important one because they are the most prevalent. There are others and they have uses, but they all have different functions, just like our different dogs have different functions. And here is where the research has just totally exploded in the last year and year and a half, I would say. We're finding out different bugs for different functions. And that's where some of the wrong bugs get put in the bottles. It's really important to identify. So 14 of 29 strains carry species designations different from those obtained by partial 16S rDNA sequencing. Strains from 6 commercial products or species were not listed on the label. What they're talking about there is the genetic drift. Okay? One has changed to another, and now it's a foreigner. So they've lost their identity. These are some of the ones that we've compared to. And this is the big one that we use in this office, L. acidophilus, NCFM strain. It's the only one that we've been able to document will reverse irritable bowel, is effective with Crohn's, ulcerative colitis, those types of things. Very, very important one. Some of the papers, the backing it up, there's lots of them. NCFM is the progenitor of the strain being used for complete chromosome sequencing, and therefore will be a cornerstone strain for understanding the relationship between genetics and probiotic functionality. What all that means is that this bug can change your genetic expression. It shuts down your bad genes, helps your good genes. Okay. The L. acidophilus NCFM and bifidus strain, we know has desirable cyst characteristics for use with yeast overgrowth. It used to be my only weapon for yeast growth. And I always likened it, okay, you got weeds in your lawn, let's crowd it out with giving you lots and lots of grass seed. We used acidophilus to totally overrun yeast. Very effective. Took a long time though, about a year. Now we have other ways to do it, and we can do the same process in just 2 months with something called Probiotic, which is yeast, but it's competitive yeast, and I'll talk about that in a sec. So here's some of the research updates on it. And what's really interesting that I want to pick out of this one is that it reduces precancerous lesions. We do this, for example, if somebody comes in with a positive pap smear. I always reassure the woman, I think we can return this to normal within 3 months. And how do we do it? We give more precursor of folic acid to increase something called methylation. If you're at last seminar, you'll recognize that word. And we also give probiotics. Reverses the precancerous lesions to normal in 3 months. You can do the same thing with precancerous lesions on the skin. It's pretty exciting. It is stable in frozen storage, freeze-dried, blended into products, and very importantly now, stable for 3 months in normal conditions. And normal conditions is 90 degrees or less. So yes, you can take it on vacation now. And here I've got the proof for stability. It's very stable at 4 degrees, 22 degrees Celsius. Now we're talking 70s. And here we're talking close to 90. But notice at 90 that it starts dropping off quicker. And this is why we ask our patients to refrigerate the product, because it just stays better. But this is in over a period of 24 months. So just so you have an idea how long it stayed good for. So functional genomics is where most of the research is now going on, and that is really genetic research. We also use this for bacterial vaginosis. So anybody who has a bacterial or a yeast infection that's vaginal in nature, we use this. It can be used as a vaginal douche or taken orally or both. And it's amazing how you can permanently get rid of vaginosis in patients. Yeah. So you see, we've got just tons of research on this, and I don't want to belabor the point too much because I see some eyes starting to glaze over, but this is where I think it gets interesting. So I'm just flying through this for you and trying to pick out the little nuggets. But the quality control, again, is extremely important. I've seen too many duds. And really, my very first exposure to duds was that when I first started practicing here and started recommending nutrients, and I was not able to replicate results that I was used to seeing in research. And back in the Netherlands, started testing just the vitamin C in bottles because that was the cheapest and easiest test to do, and found that on average vitamin C in bottles, this is now 24 years ago, was only about 20% what's on the label. And that trend continues to this day. I have new research because I've been looking for a vitamin D that's in liquid form for kids, and we have results on 7 different vitamin Ds from major manufacturers. Not one came close to passing the test. The best one was at 33% of label. Isn't that just a crime? It's just absolutely criminal. And I hate that. So to this day, I don't have a liquid vitamin D for the kids here. They have to crush up the hard vitamin D. But it's better than giving them a kid junk. So that's why I constantly hear about quality, because it's not out there. You have to be your own policeman or woman to make sure you get a quality product, because otherwise you will not get results. And if you are getting results with a bad product, it's because of placebo. Yeah. So obviously we have to look at cost, make sure it's reasonable. You want at least 15 billion live cells per serving. Okay, that seems to be the sweet spot. That's the minimum. This is for adults. Bifidus, again, 15 billion live cells is what we use for adults. And then what we try to do is offer many different combinations. And the combinations are because, well, there's not too many patients that need just one. I sometimes go with just one. And here's one of the ones that was a single one, and that's Lactobacillus plantarum. And we use that one in irritable bowel syndrome that has a lot of pain with it. Pretty solid research, and we have that one just as a single. And yes, it does work. Our very favorite ones, though, are right here. Ultraflora Plus. Ultraflora Plus is probably our most advanced one. We reverse some very severe gut conditions with it. Lactoflamex is the one that reduces inflammatory conditions such as Crohn's, ulcerative colitis. Probiotic, this is the one that we use after antibiotics that Dr. Stacy recommended. This Probiotic is actually yeast. It's funny because isn't yeast what we're trying to get rid of? But this is a competitive yeast. It bunches up the bad yeast and then it gets expelled. So this is pretty cool stuff. And the lactobifidovitamin combination, which is a new product here, is going to be released very soon, are the ones that we use the most. So the next seminar is, before I jump into that, I asked for this, so I should show. Show and tell. You mind, real quick? Humor me, say yes. BioPure protein is immunoglobulins. This is what we use to repair the gut wall. If the gut wall is severely inflamed, cracked, it is bleeding, BioPure protein is what we use to get bleeding under control, to give patients immediate immunity, and it's also just protein for repair, because protein is what repairs the gut. I just gave it to an athlete who comes in with continuous injuries. He was one of my last patients again, and I said, hey man, you got to go hit the protein. It's the only way to go. I think you're protein deficient. You're constantly injuring yourself on the soccer field. I put him on 4 scoops a day. Okay, and I know his injuries will stop in about 2 weeks' time. Really cool stuff. The most bioavailable protein that I know of. This is also used with AIDS patients and other immunodeficient disease kind of patients because it gives immediate immunity. Some of my patients use this throughout the winter. It's got the actual immunoglobulins in it that line the gut wall. Endorphin is our favorite powder for fiber. This is made from many different plants. Most fibers, like Metamucil for instance. Metamucil is a synthetic made fiber. It creates mineral deficiencies and dependency. You don't want to take that long term. Instead, you want to do something that is real, plant-based, and nourishes the bacteria while killing bad bacteria such as yeast. That's endorphin. This is my sleeping giant, sometimes jokingly referred to as the log maker. Bifidus is what we use with kids, and is also for large intestinal disorders. And lactovitin is the more overall general one. I am getting, we're getting rid of this one, aren't we? Because Ultraflora, and it's one thing that can drive my patients crazy because I'm constantly changing it, but that's because we're keeping so current with the very latest research. And the very latest research shows that, yes, 70% of the gut flora in babies is bifidus. So what did we do? We always gave bifidus because that's 70%. Was the very best thing going, and I'm proud to this day we got really good results with this. We have 8-year studies that show if you give just a tiny little bit the first year of life, your reduction in asthma and eczema cases by age 8 is more than 50%. Just giving it the first year of life. Why is that? You're creating better immunity. Yeah? And that's an important study because that's an indicator for autoimmune diseases in general. And it's going to carry on throughout life. Pretty important. Just like, for example, this is a little aside, vitamin D reduces incidence of autoimmune diseases by age 40 by 70% if you give it to a kid. Huge. But we now know the other 30% in kids are bacteria that we never knew, and it's in Ultraflora. So here is bifidus with those other bacteria, and it's the same as bifidus, just improved. Got that? So that's how we now utilize that. The Probiotic is the one that kills yeast, and yeast specifically. It is also the one we use after antibiotics, and yes, we use it with the C. diff. And Lactoflamix, this is the anti-inflammatory one. After we've gotten a patient going, we see a tremendous amount of ulcerative colitis, ulcers, celiac disease, Crohn's, cases like that, and things like MS, Parkinson's, autoimmune inflammatory disorders, rheumatoid arthritis, Lactoflamix. And this will get rid of the inflammatory bugs that produce all those toxins that go systemic. So, real specific, kind of cool. And I feel like I'm in kindergarten doing my show. Artemisinin is the one that I should have gotten a Nobel Prize for. Because the World Health Organization just put up somebody for a Nobel Prize for discovering that artemisinin kills malaria and can save millions and millions of people every year. It works better than any other drug for prevention of malaria. Well, I want you to know I have been recommending this for over 20 years for malaria. And it was really based on research, which was folk medicine back in the Netherlands, that they use for missionaries. They use artemisinin, which is wormwood, for prevention of malaria. And we know it works, and we know it works because the natives in India and all those countries that are stricken by malaria use this, not the drugs. So really, it's not rocket science. We were going on a tradition here, and I figured, oh, if it worked for 1,000 years for them, it should work for my patients, and we've been using it. But apparently somebody else is getting the Nobel Prize. But in the meantime, I have found another use for it. So my hopes for a Nobel Prize is still alive. And here it is. It is, we now know through very current research that was just published a year ago that artemisinin gets rid of anaerobic bacteria. And these are the toughest bacteria to get rid of in the gut because they survive without oxygen. It's really hard to get to them. It gets rid of them. New use. My fame might spread again. Lauricidin. Lauricidin is coconut oil concentrated many, many times over. It is so potent that this is the product that helps me get rid of yeast in patients in 2 months versus a year that it took before. Lauricidin is so cool that I have found by accident, this is not science now, this is totally what we're finding in the trenches here. We're finding that our patients that we put on this, their asthma disappears mysteriously. Isn't that cool? and it disappears within weeks in some patients. And I just stumbled on this. I've not seen it anywhere in the literature. I've repeated it with other patients, and the way that that works, and this is my theory now, is it just gets rid of the bad bugs. That creates evil byproducts in the gut, which then triggers the immune system, which creates asthma, because asthma is an autoimmune disorder. Cool? I think so. And so this is how in holistic or functional medicine, if you treat one thing, you have unknown benefits in many other spots, because it has this whole ripple effect that affects the brain, the joints, the skin, everything. And it is so much fun to watch a patient start flourishing, because they came in for a sore knee, but what really started happening to them is they started becoming healthy all over. Unbeknownst to them, the arteries are opening up, the brain fog is leaving, their sinus infections are gone, and all those things go on and on and on and on. So that's the ripple effect that we love seeing, and who knows the things that are changed that we don't even know about. So the next seminar is going to be a switching a gear seminar. We're all going to chip in on this one, and really it's an environment seminar. No, you're not talking to a bunch of tree huggers, although if you want to hug a tree, I have actually seen some research that show it has benefits, believe it or not. And there appears to be, this is really out there, so don't call me as a loon, but this was published not that long ago. A tree has deep roots, right? It literally pulls electrons out of earth and pushes it upwards, uses energy into the leaves. And if you hug a tree, and some of your skin has to be bare, okay, and you stand there for 20 minutes hugging a tree, there is some sort of electron reset within your body that is measurable, and your antioxidant potential, in other words, the antioxidants in your body, goes up significantly. Isn't that just absolutely fascinating? So I'm going to have to try this. So if I come in someday looking like I'm just 20 years old, I hugged a tree. So we're going to be talking about the environment, the pesticides, like the antibiotics, but also mercury and just all the unknowns, the foods. How do we choose our foods? Genetically modified foods. What does it do? Our makeup, our water supply. What are the best filters? That stuff is what we are doing next time. It's going to be a fascinating seminar. It's going to be a very important seminar because we don't focus on that quite enough, and we're doing things to ourselves unbeknownst to us that we shouldn't be. So we'll have fun with that one, and I look forward to seeing you then and there. Bring a friend because this is important information and that I want to spread around. We're going to open it up to questions.